Thank you for being here today. I would like to acknowledge that we are gathered together on the traditional territory of Treaty 7, and Métis people of Alberta share a deep connection to this land. I am honored to be joined today by the leader of the official opposition and a proud defender of Alberta's public healthcare system, Rachel Notley, and by my colleague Luanne Metz, MLA for Calgary-North and NDP Health Critic for Emergency Services and Surgical Care. During this election, residents of Calgary-Northeast named healthcare as one of their most pressing concerns. They shared their experiences with crowded emergency rooms, longer wait of Alberta Health Services. And as the leader is about to tell you, this is a man with a long history of privatizing our public healthcare system.
Thank you very much, Gurinder, and thank you, of course, Luanne, for being here. And thank you for everything that you're doing, particularly through your bill that I'll talk about in a minute, to protect our public health care. And as Gurinder said, Lyle Oberg has been advocating for the majority of his career to put out policies that support paying out of pocket for basic health care. He was the co-author of the 1993 report called Starting Points, Recommendations for Creating a More Accountable and Affordable Health System. It's a long read, really quite long, but so we are happy to distribute digital medias to the media. But we've already saved you the trouble and read it for you. So let me give you the Coles Note version. One of Mr. Oberg's major point is that consumers, meaning everyday Albertans who need health care, should pay for non-essential health services. Oberg writes in this report, and I quote, "When health service is perceived to be free, it suffers reduced value and becomes subject to abuse," end quote. He goes on to say then, quote, "Health services deemed non-essential will still be made widely available, but will require partial or full payment by the consumer." Now, some of the non-essential services that he suggested might not be included as basic health services include as follows: routine mammograms for women under 45, tests for prostate cancer, x-rays, ultrasounds for pregnant women, pain medication for people with arthritis. Now, the report also suggests that these services would instead be subject to fees that were charged to all Albertans, including seniors. But it doesn't stop there. As a former member of a Conservative cabinet, Oberg also wrote an article suggesting that patients who could afford to pay out of pocket for medical treatment should be able to skip the line. If you got the money, use it. He also tried to start Canada's first for-profit private hospital, which ended in a maze of lawsuits before they could even break ground. That is Lyle Oberg's record. And that is who Danielle Smith put in charge of Alberta's health services. Our province, nonetheless, values public health care. Albertans have been clear to us about this fact. And they don't want to pay to see a doctor, and they don't want Danielle Smith to take apart their system. And that's why I've joined Gurinder and Luanne here today, to cast a light on the very disturbing ideas that Lyle Oberg has proposed over the past, but also to bring forward a potential solution, a potential opportunity for this government that would go a long way towards reducing the fears of Albertans. And that opportunity rests in Bill 201, which was introduced by Gurinder earlier this month, and which comes back to the legislature for a vote this coming Monday on November 20th. Bill 201 is simple and straightforward. It's got just two parts in it. First, it would protect Albertans' rights to access healthcare without ever having to worry about whether they can afford it. And second, it would strengthen accountability measures and clearly outline the penalties for any provider that tries to violate the Act, something that we actually witnessed earlier this year. Those examples are why we know this legislation is necessary. Now, as Dr. David Keegan, a family doctor and professor at the University of Calgary's Cummings School of Medicine said, and I quote, "We should have legislation to cement this guarantee and back it up with proper funding to stabilize our health system and focus on prevention and primary care," end quote. So the Alberta NDP has made a commitment to the people of this province to uphold and improve public health care across the province. And Bill 201 is an important step towards achieving that goal. Danielle Smith, Lyle Oberg, and quite frankly, every member of the UCP are asking Albertans right now to trust them that their health care will stay publicly funded. They ask for that trust when they have done absolutely nothing to earn that trust in the last 4 years and many, many, many years before that. In the last 4 years, what they've done is threatened to roll back wages, picked fight with doctors, and failed to consult with people working on our healthcare system's front lines. And we're still waiting even now just to learn how much their boondoggle with our lab services has cost Albertans. And now, they are setting out to do even more damage with their agenda to dismantle our public health care. So how can we take Danielle Smith and the UCP at their word when they've appointed a person in charge of this process of dismantling our public health system who has spent a lifetime advocating for privatized health care? Why? How can we possibly trust them? Danielle Smith and Lyle Oberg are not allies of public health care. If they were, their plans would include fewer boards, agencies, and councils, and focus more on frontline workers and the concerns of everyday Albertans who are struggling with access to care. So there's still much work to be done to solve these issues, and it won't happen overnight. But right now, Albertans are still facing a cost of living crisis, and they are struggling to afford their basic needs. Costs all across the board have skyrocketed, and the last thing they need to add to that list is a doctor's fee. Bill 201 provides a chance to put those fears to rest. The UCP can vote in favor of it on Monday, or conversely, they can come clean with Albertans about their plans to privatize our health care. The choice is theirs, and I hope that they will make the right one. Albertans will judge them accordingly. So thank you, and I'd be happy, and any of us would be happy to take any questions you might have.
Thanks, folks. Do you want to just prompt on there, and then folks in the room that have a question, I just need you to kind of move towards the map, just because we're in a small space, and I don't want to knock over 5 cameras simultaneously.
So we'll now open up to questions. For those joining by Zoom, it's the *9 or raise hand function. Can you please state your name and your affiliate off the top? And we have time for one question, one follow-up today. Starting with questions in the room.
Hey, Tim Burke with CTV. Not to deviate from what you guys are talking about, but I saw your tweet. I know you want us to ask about the Manning report, so just general reaction to that report from you.
Well, you know, there's a lot in that report, but certainly I think if you focus on Chapter 3, what you see is an invitation to normalize conspiracy theories and pseudoscience at the expense of evidence-based medical care. So that's very, very concerning to me. I don't think that under any circumstances, any public servant should ever be asked to give serious consideration to the provision of horse tranquilizers to Alberta patients as a means of caring for COVID. Yet, if you read between the lines in Chapter 3 of this report, that's exactly what they are calling for. So I'm not surprised, given the opinions that Preston Manning has articulated over the many years and those of our Premier. But that is not good news for Albertans. That's not good news for our safety and the quality of our health care.
And then another topic. Would you ever consider pushing the party to change its name away from the NDP? And maybe a double-barreled question, but do you think the name is currently holding the party back in any way?
I am very proud of the name NDP, New Democratic Party. Interestingly, when you talk about brands, it is very much associated with two things that are huge priorities of Albertans right now. They care less about the name of the party. What they care about are the state and the quality of their public health care, and whether or not they can count on it for that to be there for them and their loved ones when they need it. I also had nearly 500 people out to a town hall in Edmonton last night, and 99% of them are deeply concerned about Danielle Smith's plans to steal their CPP. So those are issues that people actually care about. Interestingly, those happen to also be issues that are very much tied to the NDP brand, because we played a critical role in establishing both of those incredibly important programs that make life better for Albertans and Canadians all across the country. So I'm proud of our brand, but more to the point, I am focused on turning our attention to the issues that matter to Albertans. Healthcare, CPP, cost of living, affordability. Those are the things that Albertans want to hear us talking about.
Your response to the group, Alberta's Progressive Futures proposed name change to distance the provincial party from the federal NDP.
Yeah, no, again, I think, you know, they can do whatever they want. I'm more focused, and I think what Albertans want from us is for us to be more focused on the issues that matter to them. Healthcare, CPP, affordability, the housing crisis. That's what they want their official opposition to do, and those are the issues they'll judge us on in the next election. Have we acted with integrity, with honesty, with a connection to the values they know they can count on from us, and have we delivered on their priorities? That's my focus.
And just again, I know that you looked at CTV towards it, but just towards global, again, the second question, in regards to, you know, the former reform parties, you know, recommendations. What are your thoughts on those?
Well, as I've said, there's a lot in that report, but I would turn people's attention to Chapter 3, which really reads like an invitation to conspiracy theorists and to pseudo-scientific purveyors at the expense of evidence-based science and medicine. Under no circumstances should any public servant in this province, physician or otherwise, be compelled to give serious consideration, for instance, to the delivery of horse tranquilizer to people who are suffering from a serious disease or illness. So it's an incredibly irresponsible report, and it's hardly surprising based on some of the extremist fringe views we have seen expressed by both Danielle Smith and Preston Manning.
Perfect. So we'll now go to questions on the line. Again, it's the raise hand function of *9 by phone. We'll start with Janet French. You should be able to unmute.
I really apologize for the background noise. I just wanted to ask you about, in the Manning report, there's suggestions about the AEMA taking over all emergency management, including public health emergencies. How much merit do you think this idea has, and why?
You know, listen, I think that the AEMA actually does need more resources. I will give you that. You may recall that when we were in government, we had planned to invest in a new provincial operations center, which is something that AEMA very much needs. And so more authority and more resources in certain circumstances, not necessarily a bad thing. But depending on the state of the emergency, I think there needs to be some flexibility. And a public health emergency and public health crises have their own legislative schemes for a reason. And so I think that there's a lack of awareness of that fact in this report. I think that if you read between the lines, this report has multiple efforts buried within it to limit the scope of scientists and medical professionals. And I think that is bad news for Albertans, both in terms of their day-to-day public health needs as well as public health requirements in emergencies.
Do you have a follow-up, Janet?
I do. So there's also a suggestion, just reading between the lines of the recommendations, that children's rights to access education were violated during the pandemic. Do you agree with this premise that children's right to access education were violated during the pandemic and would require legal strength?
Well, you know, I don't know that I would approach it from that angle per se. What I will say is that there's no question that the government of Alberta failed deeply to provide the resources required in our schools to keep children going to school safely. They disrespected teachers. They fired 10,000 educational assistants. They changed the rules over and over, and they gave mixed signals to families, all while educators were dealing with folks who were in different states of crisis. And over and over and over, we called for the government to provide more resources so that education could be provided more safely, so that class sizes were made smaller, so that folks would get more support for online learning where that became necessary. And there was a whole range of good reasons for why online learning might become necessary over the course of COVID. Yet, if anything, resources diminished during that time. They didn't go up. So I would say without question that the UCP abandoned the rights of our children during COVID. We also called for extensive additional investment in mental health supports in our schools. That too was ignored by the UCP. So whether it's a right or not a right, that's fine, but the real issue is that they abandoned the providers of education and, most importantly, the children who needed that education and their families over COVID by failing to provide the resources necessary to ensure that our educators and our kids could do what they do best in a safe way.
All right, up next we have Graham Thompson. You should be able to mute.
Hi, it's Graham Thompson with the Star today. You mentioned section 3. I've been looking at section 7, and it's long, and you know the whole report's long. But I was wondering if this, reading between the lines or even reading it, that this is a way for the government to try and justify changing the Bill of Rights or the Human Rights Act to include protection against discrimination for those who are willfully unvaccinated. Is that something you see? I'm looking at 7.30. It says description of discrimination against which Albertans should be protected would include opinion, disability, and medical status.
I think there was a number of things in that section that were worrisome. The prohibition on so-called coercion would likely be used to negate ideas like the vaccine passport system, for instance. I think the whole rewrite is absolutely about putting the right of individuals over the right of the community as a whole, so that you could literally have somebody assert that right to refrain from getting a vaccination and then walking on in to an intensive care unit full of people with extremely compromised immune systems and doing their thing because that's their right. And so I think that that's what they're getting at in there, and that's part and parcel of what Danielle Smith and Preston Manning both believe. But listen, you know, it goes back, it's old school. It's really, really old school, Graham. You know, Danielle Smith and Preston Manning would argue that if your house starts on fire, you should have the right to let it keep burning, even though it is catching onto your neighbor's house and your neighbor's neighbor's house and your neighbor's 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 house. And that is old school community coming together to say, no, we're all going to come together and we're going to put that fire out because it's better for all of us if the fire stops. And Danielle Smith sees that as an infringement on liberty. And that's why the way they're approaching this issue is not going to help Albertans in the long run.
Do you have a follow-up, Graham?
Okay. Yes, sorry, and I'm going to repeat some of the questions that were asked before, and I apologize. I was going back to this thing regarding the idea of rebranding the NDP. There was a study, the group doing this had a survey done by Janet Brown saying that Albertans think that the federal NDP has too much influence over the Alberta NDP. Is that, and this may have influenced people's votes during the election, is that something that you think is right? Sorry, in other words, the idea or the perception is correct that the federal NDP has too much control over the NDP in Alberta? And do you see that relationship as being too close? Or do you want to loosen that connection? Because you have spoken out against the leadership of the federal NDP in the past, but do you think that people see the one influencing the other too much?
No, I think some people have watched one too many UCP ads, but I don't believe that that actually was a vote mover in the last election. Listen, the Alberta NDP listens to Albertans and is focused on representing the best interests of Albertans. And we have a long record of standing up for Albertans regardless of what is happening in other jurisdictions, whether it be the BC NDP over the issue of TMX, or whether it be the federal NDP also, frankly, over the issue of TMX. So we've done that, and we will continue to do that. But I think what's happened is, anyway, so that's how I view it. I think we will be judged on our record. And what I know to be true about the NDP brand overall is that we are understood to be the most reliable political party when it comes to protecting healthcare and ensuring people don't have to pay out of pocket for their healthcare. People trust us when it comes to education, to make sure that their kids can get a good education. Just two examples. People trust us on the matter of CPP because we were one of the parties that made sure that it was developed back in the 60s. So we have a brand that is based on a record, and overall, I believe that along with our past actions as the Alberta NDP and the hard work that we do each and every day to talk to Albertans and to represent their priorities, those are the things that matter when it comes to an election.
Can I follow up on that question? Do you want to, does the Alberta NDP want to separate itself from the federal NDP?
No, we're quite comfortable with the relationship we have right now. We do the work to represent Albertans, to ensure that their best interests are served, and where that diverges sometimes from other political organizations, including the NDP around the country, it diverges. That's no different than in any other political party. But there are a lot of places where we have a shared set of goals. Protecting public health care being one of the most important elements of that.
Great, we'll go to Dean Bennett next. Dean, you should be able to unmute.
Thanks, Rachel. You can hear me?
Yeah.
Two pension questions. First one is, you had your first in-person town hall last night. What were the numbers and what did you hear?
So we had nearly 500 people there, and so that was exciting. Periodically, we would just ask people to give us a show of hands, and I will tell you that there was one hand that went up out of almost 500 people when asked whether people wanted to leave CPP. We did have, I think, about 20 people come to the mic to both ask us questions and give their comments. And mostly they raised the concern that they're worried about the security of their retirement future. The other thing that was a bit inspiring and maybe slightly bit of a surprise to me was the level of support that everybody in that room had for their fellow Canadians, and their belief that they didn't want to do something that was going to undermine the retirement security of Canadians all across the country. And there was a strong identification with people from around the country. Many people who talked about coming to Alberta in their later years or in their working years, but originating from other parts of the country, and seeing Alberta as an opportunity in the midst of a strong Canada. So those were the two key themes that came out to me.
Do you have a follow-up?
Thanks. Yeah, that dovetails with my second question. I apologize for the preamble. Because same points came up last week in the Jim Dinning Calgary Town Hall. Two of the callers said, you know, why are we doing this? This could hurt fellow Canadians, and is this really a Canadian thing to do? The chair, Dinning, he challenged that. He just said he challenged the term greedy, and he said that, you know, he doesn't consider Albertans greedy, and a lot of the Albertans he knows aren't greedy. My point is, if he's cast himself as sort of the agnostic message deliverer, he's to hear the feedback, and then he's to deliver the feedback. If someone who is in that role starts arguing or basically inserting him or herself into the debate, what does that do to the debate? And what, if anything, does that do to the nature of the feedback he will ultimately give back to the Premier?
Well, listen, I've heard Jim Dinning speak enough to know that he comes to this issue from one particular side of the debate. He's very, very interested in the Alberta pension plan idea and withdrawing from CPP. You don't have to dig too deep to see that that's his preference. He is also shilling a report which is full of misinformation, which is driving a number of claims to Albertans, which are frankly not accurate. They're wildly out of line with what Albertans can actually expect. So there too, he has unfortunately revealed his bias. So I don't expect that Albertans can anticipate a fair description of what that panel has heard. And part of the reason too is because it's not in person. They're picking and choosing whose call they take. They're picking and choosing whose question they answer. I will tell you, I mean, we gave about a week's notice of our town hall, and we had 500 folks, or almost, not quite 500, almost 500 folks show up. And the level of consensus was quite remarkable. Now, I know that, you know, the more you get to younger Albertans, it becomes slightly, it's still a majority are still opposed to it, but it's not quite as big a majority. But nonetheless, when I hear the questions and the comments that are happening on the Dinning panel, it's clear to me that it's a very curated conversation, and I suspect that the feedback will be equally curated.
Perfect. We'll go to our next person. It's Mandeep. Mandeep, you should be able to unmute now.
Hello, can you hear me?
Yeah, sure can.
Yeah, Mandeep, this time from Prime Asia TV. My question is for Rachel. Rachel, how are you doing today?
Very good, thank you.
Okay, so my question is related to the sovereignty. Rachel Smith has passed the Sovereignty Act when she started her government, and I believe the CPP, the privatization of health, and all other like the education problem here in Alberta all start from. Can we expect the separate nation in future? As she's eyeing on the CPP's fund, like it's about $334 billion. They're asking from the CPP to get for the Alberta pension plan here in Alberta. So what should we expect from them, like how they are actually interpreting the Sovereignty Act here in Alberta? Thank you.
Well, I think that at this point we've not seen them use the Sovereignty Act, so they haven't done that yet. I suppose they could try to use it ultimately with CPP, but I don't think it would get them very far. I think that it's so unpopular with Albertans that it would be a bad use of it. At the end of the day, once this government tries to use the Sovereignty Act, it will almost immediately go before the courts, and the question of whether they are actually entitled to use it the way they think they can will end up having to be debated by the courts. And there are different elements of the Sovereignty Act which are illegal, not the least of which, and in fact the most important of which, is that it breaches fundamental constitutional rights of First Nation Albertans and Treaty Albertans. So then there's other elements to it that are also, I would argue, not likely to withstand legal challenge. So, you know, at some point she'll try to use the Sovereignty Act, but I doubt that it will get very far. It will just create a whole bunch of investment uncertainty while it's sitting there, while people don't know exactly what the outcome is. And that's been the other big problem with it all along, is that it drives investment out of Alberta because folks can't be 100% sure what laws they can count on.
Do you have a follow-up, Mandeep?
Thank you.
So we've heard a lot of your reactions, you know, to Manning's report, to, you know, what the Premier is doing. So again, what are some of your recommendations from starting points that you just released today?
So Starting Points is actually a report that was written by Lyle Oberg back in the early 90s. And it is a report within which he advocates for a number of different ways to privatize our healthcare and make people pay out of pocket. So we're just bringing this report forward to make sure people understand that this guy, who has been advocating for private healthcare as long or longer than Danielle Smith, has now been put in charge of AHS under her watch with all of this reorganization. So we're very worried about it. On the other hand, Gurinder Brar here has introduced a bill, a private member's bill, Bill 201, our first bill of this new session. He introduced it a couple of weeks ago, and that would ban anybody from ever being told they had to pay money in order to get access to a doctor for insured services. It's a very low bar. It's an easy thing for Danielle Smith and her UCP to support if they truly have no intention to start privatizing our healthcare. And if they do, well, then they'll vote against it on Monday. And that's our call today.
So that's all we have time for today. Thank you so much for logging on.
Thank you so much.